Hello, this is Aaron Shoemaker, and I'm here today with Dr. Tom Schlueter. He's one of our heart failure cardiology specialists. And today we're going to talk to you about one of our START goals, which is a CHF all-cause readmissions reduction program and goal. So, Tom, what is the goal for this year for our START plan?
It's a really interesting and exciting goal. It's really more of a population health management goal where we talk about reduction of all-cause admissions for people with heart failure. And what we're looking for is a very, to be honest, modest reduction, a 2.5% reduction, which for our system would translate to about 65 cases or so.
What patients are at risk for admission in the CHF cohort?
That's a great question. We see a lot of times with chronic disease, particularly CHF is common with the other chronic diseases. So the people who have really 4 or 5 different diagnoses along with heart failure and diabetes and COPD and dementia and other things, those are the cohort that's really high risk for this.
Do we have a sense of why those people admit frequently?
We do. There's lots of different reasons they come in, but they generally seem to be centered around breathing type of things. Fluid overload, a congestive heart failure exacerbation. A lot of these people have COPD and pneumonia as well. So focusing on the breathing aspect of it from a heart and a lung standpoint seems to be one of the biggest things we deal with, in addition to the chronic other diseases, diabetes and so forth.
So I know we're getting a team together to start to work on this, and I agree it is an exciting measure, and because it's putting population health framework around the CHF population. So what are some of our initial recommendations around that group?
It's really interesting because it's such the good care that's always been delivered. So you talk about, in my mind, we kind of break this down between good care and then focusing on heart failure. So things like the pneumonia vax, things like the flu shot, things like good diabetic management, not smoking, exercise, all those things that we are doing with our patients each and every day. And then specifically, there are some evidence-based measures with heart failure. We're going to work with our primary care doctors and really defining the different types of heart failure, defining the different treatments, and trying to find a way to make it easier for all of us to care for these type of patients.
Great. I know we have discussed the potential of working with education for primary care. And maybe there's some opportunities for people to join us in that?
I think so. What we'd really like to do is put together a focus group of people who have a passion and a knowledge for this. We can supply a lot of the content for heart failure, but it does no good for a cardiologist to come in your office and tell you how to treat heart failure. I can give you the information, but I want to make it so you can use it and use it in your day-to-day practice with the patient right in front of you.
Great. Thanks, Tom. I think you're going to see a lot of work going on around this. We'll be getting high-risk patient lists to you. We'll be doing things like working on flu and pneumonia campaigns to try and help these patients. But at this point, we'd really love to have anybody who's interested in working with us on a focus group on what we as primary care want to be educated about congestive heart failure, just to let us know over the next week or so as we're going to be pulling that group together here over the next month. Thanks, Tom. And
My pleasure.
Thank you guys for everything you do.